Welcome to a deep dive into the complex anatomy of the hip. In this video, I'll explore the critical components of the hip joint, from bones and ligaments to muscles, nerves, and blood vessels. Let's get started. The hip joint connects the femur, or thigh bone, to the pelvis. At the top of the femur, the femoral head fits securely into the acetabulum, a rounded socket in the pelvis, forming a ball and socket joint. A short section of bone, known as the femoral neck, connects the femoral head to the rest of the femur. Beside this neck lies the greater trochanter, a bony landmark we can feel on the outside of the hip, where large muscles connect to power hip movements. The hip is protected by articular cartilage, a rubbery shock-absorbing layer covering the femoral head and acetabulum. This cartilage, around a 1/4 inch thick in the hip, allows smooth, friction-free movement and bears significant forces from walking and running. This cartilage is especially thick at the upper and back part of the acetabulum, which bears most of the force when we walk or run. Its shock-absorbing properties make movement easy and prevent damage from friction. The pelvis itself is formed by 3 fused bones, collectively known as the innominate bones, the ilium, the ischium, and pubis. These create a solid base for the upper body and support the hip. Below these bones, we find the sacrum, a large triangular bone formed from fused sacral vertebrae, and the coccyx, the final section of the vertebral column. Ligaments are strong bands of connective tissue that stabilize the hip joint by connecting bones to each other. The joint capsule, a watertight sac of ligaments around the hip, is the main source of stability, supporting the joint and limiting excessive motion. Key ligaments include the iliofemoral ligament, which connects from the anterior inferior iliac spine to the intertrochantic line on the femur and limits hyperextension. The pubofemoral ligament, which connects the superior pubic ramus to the intertrochantic line and restricts excessive abduction. And the ischiofemoral ligament, connecting the ischium to the femoral neck, limiting internal rotation. Together, these ligaments help the hip remain stable through a range of motions. Another ligament, the ligamentum teres, connects the tip of the femoral head to the acetabulum. Though it doesn't assist with movement, it carries a small artery that supplies blood to the femoral head. Tendons are tissues that attach muscles to bones. The iliotibial band is a key tendon running from the hip to the knee and supporting large hip muscles. Tightness here can lead to hip and knee pain. Another critical structure is the labrum, a ring of tissues around the acetabulum that deepens the socket, providing added stability for the femoral head. Several muscle groups support hip function and stability, beginning with the gluteal muscles. The gluteus maximus, gluteus medius, and gluteus minimus. These muscles assist with hip extension, abduction, and keep the pelvis level during movement. The inner thigh muscles, called adductors, bring the leg towards the body center and include the adductor longus, adductor brevis, and adductor magnus. In contrast, the abductors, like gluteus medius and gluteus minimus and tensor fasciolate, move the leg outwards. The hip flexors, like the iliopsoas, rectus femoris, and sartorius, allow us to lift the leg. These muscles connect from the spine and pelvis down to the femur. The hip extensors, including the hamstring group and gluteus maximus, extend the leg backward. Major nerves pass through or around the hip, including the femoral nerve at the front, sciatic nerve at the back, obturator nerve to the inner hip. These nerves control muscle movements and transmit sensations like pain and temperature. The femoral artery is the main blood vessel supplying the hip and lower limb, branching into smaller vessels that nourish the femoral head and hip muscles. To reduce friction between muscles, tendons, and bones, the hip has bursa, fluid-filled sacs that cushion and lubricate. The greater trochanteric bursa lies between the greater trochanter and surrounding muscles, while the iliopsoas bursa cushions the iliopsoas tendon near the hip joint. Bursa can become inflamed, causing hip pain. The hip joint is exceptionally stable due to its design. The labrum and joint capsule create a vacuum effect that holds the femoral head firmly in place. The lunate surface of the acetabulum provides a weight-bearing surface, while the joint capsule and surrounding ligaments prevent excessive movement. Finally, we'll cover some key landmarks. On the pelvis, the iliac crest and greater trochanter are easy to feel, as well as the ischial tuberosity, known as the sitting bone. The femur also has notable points, like the greater trochanter, where external rotators attach, and the medial and lateral condyles at the knee. The hip balances flexibility and stability for movement and support. Understanding its anatomy helps us appreciate how it supports everyday motion and intense physical activity. Thanks for watching, and subscribe for more anatomy videos.